the other thing you have to consider is epigenetics, which is to say
How your environment affects your genes.
well, I'm specifically thinking epigenetic handoff, which is to say the fact that epigenetics can be inherited, which means that if your parents had bad environment and the cues that their bad environment gave their genes to develop small jaws, then their genome
have a tendency towards that direction.
yeah, right, exactly. Because their genome is not coding for the proteins that cause big jaws, those genes are shut off by the environmental cues that they had whenever
And they can pass it over to you
the
by
epigenetics
code or by their behavior.
genetically. It gets the
By code. Wow.
epigenetic shutdown of the small jaws could be transferred to you so that even if you had good environment, you're still not coding for the big jaw proteins. Yes, it's clear now that epigenetics can be inherited. So then you have this cycle. You have this cycle of small jaws that happens from generation to generation. Yep, it's recording now.
Do we need to do the whole hello thing again, or?
Oh wait, you want to record? You want to record it for YouTube?
I mean, man, it's your channel. I mean, if you want, I'm down with it. I don't mind.
Sure. If you're okay with it, then we'll see how it goes.
Right. If it's good enough.
Not even if it's good enough. If you're okay with it, then I'll throw it up, man. Of course.
Yeah, man. Go ahead.
No That's problem. Awesome. Cool. So yeah. So what's going on, Ohad? How can I help?
I'm in Fort Myers right now, and the reason I'm in Fort Myers is this, and this is big. So my cervical spine ligaments, they're done. They're completely effed. So does my shoulders are also unstable, and they diagnosed me with a syndrome called EDS. Essentially, it's in layman's terms, it means that I'm kind of hypermobile. Now, here is the thing. I'm confused about something. If you read, are you familiar with Starecta?
Yes.
So if you read their stuff, their point of view is if your jaw is misaligned, it will slowly destroy the entire skeleton, your entire posture, slowly over time. Now, I'm not sure I agree with that statement. Definitely, it could cause issues. Definitely, there's no doubt in my mind. But will it cause instability in the shoulders, hips, to that extent? I don't know. It doesn't. I'm not sure. How do you feel about this?
I feel that it does and that it can, but that you can power through those issues just by brute force, by exercising a lot, by doing a lot of weight training. That's my approach. My approach is someone whose jaws are bunk in their adulthood, they're never going to get it right fully. And so you can't wait for your jaws to be perfect for you to treat the rest of your body. You just got to blast your body with weight training.
All right.
To make everything strong.
This is me before things went south. I'm not sure you can see it. I might send a screenshot if that's something that are you able to see that?
Yeah, I am. Yeah, you look big.
I was buffed and big, man. I was very strong. But when my neck lost it, everything collapsed. My nervous system, my strength, I get vertigo, dizziness, ringing in my ears. It's really bad, really, really bad. Now, I don't know, man. I mean, I'm sure that muscle could help stabilize you, but to what extent? I mean, when things went bad for me, I was pretty strong, man. I was pretty.
So what happened? What was it a gradual change?
I'll explain. So I've always dealt with instability. I dislocated both of my shoulders as a teenager, and I always felt kind of hypermobile, right? So in the last 10 years, I got the weirdest symptoms, man. Headaches out of nowhere, head pressure out of nowhere, ringing in my ears, dizziness, vertigo, tinnitus, digestion problems. Like, it was bad. And I went to like a ton of doctors. They all thought I was crazy. Some of them even offered, psychiatric medications. And they all thought I'm just insane.
It's very common, sure.
So one night, like I went to bed and my head was in this funny position. Like I was tilted to the left. I remember waking up at around 2 or 3 a.m. trying to move my legs and I couldn't. And I felt this enormous pressure in my head. And I was so confused. I wasn't able to gather my thoughts. Everything was mixed. One thought with inside of another thought. It was, I'm getting out of bed. I'm trying to walk, but I can't. I'm trying to speak, but my mouth won't respond. It was that bad. I end up like falling on my partner at the time. She takes me to the hospital. They do a bunch of tests. And guess what? They're saying, you're good. There is nothing to worry about. You're fine. And I can't walk. At that point, I can't even walk at that point. And they're saying, no, you're fine. Go home. So I knew that something was off, right? That doesn't make any sense. So I started researching, and when they did the head MRI, they did an head MRI, and the only thing they saw was that my jaw joints were basically like completely, what's the word for it? Like when you have a lot of tear and wear and tear.
Yeah, like they were resorbed.
Yeah, that's the word. And I started researching online, and then I kind of figured that there's a connection between your jaw joint and C1 and C0 and like the whole cervical spine. I kind of figured I have hypermobility. I went to the only doctor in Israel that knew about this problem. And from that, I kept learning more and more. Here is the thing. So if you look at my profile, you'll see that my mandible is recessed. Would you agree with that statement?
Yes. Yes, I would.
So I'm wondering, is it because it's not fully developed, or could it be because that the TMJ, like the condyles, they're so effed that they became shorter, which made my mandible go backwards, if that makes any sense.
Yeah, right. It could be, who knows, man? It could be a combination of both. But generally, my opinion in a case like yours is that the maxilla and the mandible are both underdeveloped, and maybe there's an aspect of the lower jaw being trapped back, and maybe there's an aspect of corrosion in the joint that's causing it to shorten even more, especially on, a lot of times that happens on one side more than the other, right? You get degradation of the joint more on one side than the other, and then that side becomes shorter, and then you end up with a visible asymmetry in the mandible. But either way, man, it's a common problem, and it's a very difficult problem to deal with, especially non-surgically.
Right. Thing is that even surgeons, is my camera still on?
Yeah. Oh, yeah.
Even surgeons, I mean, at least in Israel, they tend to be very conservative when it comes to TMJ surgeries. At least that's my experience. I could be wrong though.
Well, it's a small place. Have you had a chance to figure out who the top surgeons are and consult with a few of them about your case?
Like worldwide?
No, in Israel.
Yeah, they're shit, man. They know nothing about nothing.
That
to be honest.
surprises me. I would think that Israel, I thought Israel had a pretty sophisticated medical system and medical schools and
Well, they do, and it's true. But when it comes to that particular problem, I don't think that there's enough awareness.
yeah, which is understandable. And again, Israel is such a small place. It's probably smaller than most American states. So to expect,
Yeah.
such a small place to
No, man, they're good. I
certainly
mean,
not
they're
every
good. It's
American
just
state
that,
has a great surgeon, right? Not every American state has a great surgeon either. Maybe,
right,
really, there's only a handful of them nationwide.
right.
So,
Here is the thing. So I wanted to ask you a few things.
mhm.
First, back when we spoke, I remember you recommending double jaw surgery. Now, taking into account my current situation, um, at least in the upcoming year, that's not going to be an option. And the reason for that is I'm going through prolotherapy now. They will either inject dextrose, PRP, or stem cells into my cervical spine in an attempt to align it. Uh, I mean, not to align because you need to have a curve, but that's the only word I can come up with.
Yeah, to get it into
Uh,
the proper position.
right. So there's that. Um, you know, all right, I want to tell you a few more things. First, they checked my vagus nerve when they here in Florida. And what they found is was because my vertebrae were like out of whack, they were compressing my um, my vagus nerve, which caused a host of other symptoms. I have tachycardia now, which means that my heart rate is like off the charts. Digestion problems, like anxiety attacks. I wonder how many people understand the connection between how your cervical spine sits, your jaw, and your mental state. Because I think that the connection is way more significant than what's like commonly accepted. What's like it's like
More than conventional wisdom.
more than conventional wisdom. There you go.
Yeah.
So and they were actually able to see that when I was they took ultrasound images and they had me move my head into to certain positions and they saw that the vertebrae are just compressing the um, vagus nerve. And remember, I told you that there was this one night I went to bed and I like went to sleep with my head tilted to the left and I couldn't speak. Well, apparently, what happened, the vertebrae like was blocking blood flow to my brain, and that caused like me to get this like
Almost like
pseudo stroke.
blackout.
It was worse, man. I wish it would. I wish I would like um go to sleep. It was bad.
Yeah.
It felt like somebody was compressing air into my head, and your entire nervous system is completely shut. It's bad.
Mm-hmm.
And why am I telling this to you? And well, when we were speaking about the job, the Starecta thing solved this completely. When I put this stupid thing in my mouth, all of the symptoms I listed, they go away. So that's just that it goes to show the importance of your jaw position because people talk about looks, and maybe the fact that you get like wider airways. That's all nice, but here is an example of somebody who got his health completely destroyed by it. So, I mean, I think that people should be aware of that. You know what I mean?
Yeah, they should be aware of the negative effects of poor spinal alignment that's caused by poor jaws. Yeah, no, it's very rare, even, especially on my channel. I don't know if I've ever really discussed it, like how the jaws can affect spinal position, cervical spine position, and then how cervical spine position can flow through to the rest of the body in negative ways, such as what you're describing.
It could block cerebral spine fluid. It could block your blood flow. It could compress nerves. It's so profound, man. I've been struggling with borderline low T, and the reason for that, after like scanning my MRI, I understood that because of that the cervical spine was misaligned, it caused like increased hypercranial tension, which when that happens, a lot of times the fluids in your brain goes into your pituitary, and that's causing what's called an empty cell. And most doctors wouldn't know even how to diagnose that, because the pituitary works. It's a little bit like fluidy. It's soaked with liquids, but they think it's fine. It's very, very common. But if I think that was a major factor in my borderline testosterone levels. Now, I'm not like very low. I'm at I think at this point, I'm like 400, 500. It's not low. I used to be 300. That was like borderline low. I managed to up it since. But still, I think that people are unaware of the fact that could even, like their jaw position could even change their hormonal state.
Right. Right.
So I'm sorry, man.
No, it's good stuff, man. This is a really big deal. And I've had my own mysterious nerve issues that are probably related to positioning of my jaws. You know, I have this perpetually compressed occipital nerve on the right side of my neck. You know, it's very sensitive. If I'm not super careful, it gets really irritated. It's almost like it's being compressed on the inside at the spine where it exits the spine and goes to the periphery. And then if I'm not super careful in my motions, it gets even more agitated on the periphery, and then I get a headache. So for all I know, I mean, I've had 2 surgeries done on that nerve in the right side of my neck, and they keep digging and ripping it out and cutting it, but still there's like a deep pain in there, and maybe it's at the
Have
spine.
you considered prolotherapy?
I've never done prolotherapy, but I've done nerve blocks on that area.
Don't.
I don't
It's
do them
essentially the
anymore.
opposite.
Right.
We're talking about the opposite. We're talking about an anabolic tissue building procedure versus just blocking the nerve, killing it with Botox. Like it's a completely different state of mind. It's a completely different approach. Man, you should look into it. I'm telling you, look into it. It's something worth checking.
What is prolotherapy in a nutshell?
So
I know it's injections. I've seen it done. I shadowed a dentist who was doing it to people like in their face. You can do it all over, right? It's not just in the neck.
Some people do it on their face to look younger. Like after 3 treatments, they look 10 years younger. Some do it on their scalp to get better hair growth. I do it to sense my ligaments from like years of forward head posture and stuff like that. My ligaments are way too stretchy, so the entire structure is, it's shaky. So they will inject they will start off with dextrose. Apparently, dextrose is super like strong in like, tissue building. If that fails, they'll do PRP. PRP is they'll take your blood, they'll separate all the growth factors from it, and then they will inject that growth factors into your tissue. And there are several like paths that creates healing. One, by like puncturing through the ligament, it creates inflammation. And when you have inflammation and you have growth factors surrounding the tissue, it kickstarts a healing process. If that fails, the third option would be they will suck stem cells out of you and then do the whole procedure. But this time, instead of growth factors, they will inject stem cells. And these stem cells will convert either to ligament tissue or other tissues, depending on where you inject it.
Wow. That's remarkable.
It is. A bit painful, but, very cutting edge. So I'm going to get this done for the next 6 months. So if you wanna like check up on me and see how it goes, because if you're into it, I'll let you. I mean, I'll keep you posted.
Yeah, by all means. So what do you go once every what? Once every couple of weeks?
So since my entire body is kind of misaligned at this point, I'm kind of. I mean, you wouldn't notice it, but when I look closely, I see that I'm kind of tilted.
Mm-hmm.
So yeah, I'm doing knees, ankles, shoulders, neck. Um, so I'm doing this. So each body part should be treated anywhere between 3 weeks to 6 weeks. So I'm rotating between body parts.
Mm-hmm. Mm-hmm. What does
Yeah,
something like
okay, but
that cost, roughly?
I'm assuming like you can get away from like the range is anywhere from I would say $5,000 including tests up to 30, I would say.
Yeah.
Uh, I'm paying 30, but I'm getting my entire body fixed. I'm assuming that if it's just the neck, it's way lower than 30.
Yeah, yeah. That's actually not too bad in my opinion to get a full body makeover like that with injections.
Yeah, absolutely. Especially taking into account that it might prevent me from going to surgery.
Sure.
Surgery, yeah.
Sure, but then the question of how did you end up misaligned in the first place comes up then too, and you have to wonder if you undo all this, have you really tackled the root cause of what's causing you to go into poor alignment in the first place?
Good question. Good question. So first of all, I'm sure that my jaw position plays a major role, though I'm not sure what to do. Surgery at the moment is out of the question at this point. So I
Sure.
was wondering
Mm-hmm.
if there's anything we can do prior to surgery, like at least to squeeze something out of the situation, to get something out of it.
Yeah, that's a tough question. Um, Honestly, with someone like you who has such a complex neurological problem going on, I would only recommend that you see someone who has a tremendous amount of skill and experience. I would want to send someone like you to see Dr. Yousefian and have him do an analysis on you because I've seen some of the patient write ups that he does, and they're extremely thorough in their analysis of the TMJs and in terms of other positions of other structures, spinal position, jaw position, joints, like I said, airway. I wouldn't just shotgun an expander at this if I were you. I wouldn't just go out and do an MSE or do an ALF
Really?
or do any kind of expander without a more thorough analysis of what's going on because ultimately what you need is probably some expansion, but also you need to make sure you get the bite right in the end. That's the most important thing. Because look at how much benefit you're getting from that Starecta appliance just by
I'm worried
changing.
about this director.
What's the deal with the Starecta?
Why I'm worried, or why I think it's like why it's
First of
beneficial,
all,
or why I'm worried.
what is it? How do you use it, and then why are you worried about it?
I usually so right now I'm using like underneath this polo shirt, I have these cheap posture correctors. Are you familiar with them? They pull your shoulders back. That helps tremendously, by the way. That also like that's insanely helpful. It's like the best $50 I've ever spent in my life. Um,
I've used similar. Yeah, they do work.
yeah, you need there is some getting used to. There is like like you need to adapt for at least 2 weeks, but you have to go through like the uncomfortable period till it feels right.
Sure.
Uh, yeah, so a lot of people just start and say, "What is this shit? It hurts my back. I don't want to use it anymore," and they throw it. But I mean, at least from my experience, once that phase is done, it feels good. Um, so about Starecta, I'm worried about the fact that when I wear it, the space between my upper jaw and lower jaw increases. So in a sense, there is more vertical space to my tongue, which helps it sit lower instead of pushing against the maxilla, like the higher palate, if that makes sense. So in that sense, I think that the Starecta, and correct me if I'm wrong, could encourage vertical facial growth instead of horizontal. But that's just, what do you think about that?
Well, of course. I mean, if you wear a bite plate that heightens your bite, and if you wear it enough, then your body's going to get used to that position, and that might be good for alignment, and it might acutely solve some of your neurological problems, but it's going to come at a price, and that price is going to be what happens when you take it out. How do you function without the appliance? How do you chew? How do you eat?
You can't.
How do you do anything without it? You become dependent on it, and you're absolutely right. It does add facial length, and it's not ideal for aesthetics. Of course not.
I hear you.
I have the same concern with all removable functional appliances and splints, Gelb appliances, and similar. Um, you get so used to wearing them, and they're so comfortable, and they're great for telling you that, okay, there's something wrong here, because when I reposition like this, all of a sudden I feel better. There's an underlying issue here. But the trauma of going in and out of it, the seesaw of feeling good and then taking it out and having all of that discomfort and misalignment rush back in, it's very distressing. And in some ways, it's worse than not wearing anything at all, um, which is why I like permanent solutions to these things. I like someone like Dr. Yousefian's approach, where, yeah, he gives you the splint, which is the ApnoMed or the Apno TX. It's a removable appliance that corrects the position of your jaws. But at the same time, he's working on a permanent fix, which is actually expanding and doing orthodontics on you and getting your bite right. And the
Expanding
functional
in what
appliances
way?
is slowly phased out.
Expanding forward or expanding like horizontally?
Well, of course, the lion's share of the expansion is horizontal, because that's where the sutures are, right? You can split the mid-palatal suture with an MSE. He splits the mandible as well with the dame and expands the mandible, which is really remarkable. But yes, it's lateral. Any forward expansion that Yousefian is doing, and any forward expansion that anyone is doing, apart from face mask and double jaw surgery, is going to be dentoalveolar, which means pushing teeth. And he does have an appliance that anchors on the MSE and then pushes the front teeth forward a bit. He calls it the dome. He demonstrated that in the interview I did with him. It does give some significant forward expansion, and it's better than something like um, an acrylic expander, or God forbid, an AGA, because what those appliances do is they push off of the back teeth into the front teeth to expand the front teeth forward. And what happens is the back teeth end up going back a bit. Yes, the front teeth go forward, but the back teeth go back because you're pushing off the back teeth. And, Newton's third law, for every action, there's an equal and opposite reaction. Dr. Yousefian's appliance uses the MSE TADs that are screwed into the roof of your mouth as the kind of the platform that he's pushing off to advance the upper front teeth. So it's a unique expander. To answer your question again, in summary, it's mostly transverse, left, right, but it's to some degree forward through dentoalveolar expansion.
I understand. Um, is it, I mean, just thinking um, intuitively about it, pushing teeth forward doesn't seem like a very good idea, but I might be wrong. I mean,
No, it's not a good idea. And God knows my channel is anti-dental expansion, right? Uh, One of the big theses of my channel is expand the bone, not the teeth. But I've also always said tooth-borne expansion can be the sauce to the meat, right? It's Tooth-borne expansion is okay as the icing on the cake, but the brunt of it should be the cake itself, should be the meat, not the sauce. So a little bit of tooth-borne expansion is okay sometimes, right? As long as it's done intelligently. Is the way Dr. Yousefian does it prudent? I would suspect that it is, just because he's such a prudent, experienced guy and he knows better than to aggressively expand teeth. And again, inherently, it's different than other tooth-borne expanders because it's not leveraging the back teeth to expand the front teeth. So it's got certain things going for it. Most importantly, the fact that the heart of the expansion is occurring at the mid-palatal suture with the transverse expansion. And so there's less of a temptation to get greedy with the dental alveolar expansion because you're getting so much damn expansion elsewhere that you don't need to be greedy with it. You can just move the front teeth a little bit, keep them in the bone, open the barn doors a little bit, so to speak, get a little bit more forward tongue
How
space.
much do you think? How much forward can we go, in your opinion? Like safely go?
I don't know. The MSE
Roughly
itself,
speaking.
the MSE itself is going to expand you forward 1 to 2.5 millimeters, 1 to 3 millimeters, and then with some responsible tooth-borne expansion, maybe another 2 or 3. Not
Is
like
that visible? Visual?
oh, it's visible. Yeah, it provides a ton more support to the upper lip. It changes the nasolabial angle, which is the angle between the nose and the upper lip. It makes that more
Right.
acute.
Does it also kind of, so is that the reason some people have like, how do you call it? Like curved upper lip, which is considered very attractive?
Because they have so much tooth support behind that lip.
Or forward head, like forward head growth?
Yeah, it certainly helps. I mean, a big part of what makes Angelina Jolie's lips pop, besides the fact she's probably had some work done on them, right? I'm sure she's puffed them up with something. But yeah, when you have teeth and you have bones that provide support to the lips,
Then
of
the
course,
soft tissue follows,
of
right?
course, they're just going to be held up like upholstery on a sofa. It's just the skin is just the skin. It's what's underneath that gives the profile.
Gotcha. So in terms of like Dr. Yousefi's approach, first, where is he located?
He's far from you. He's in Seattle, Washington.
And like how long is this process? What should I expect in terms of
2 to 3 years.
and what's like how frequent do I need to see him? Like generally speaking, I mean it's of course
Generally
it's
once every 6 weeks.
yeah, man, I'm not sure it's realistic.
But honestly, man, what I do is I network in this space, and with someone like you, again, where your issues are not so simple, you have these complex neurological issues related to structure. I don't make referrals lightly in that when it comes to treating that kind of thing. I would not want you to waste time with the wrong provider doing some half measure that could make you worse. You really do need to be careful with how you proceed.
I hear you. Yeah, it makes sense.
And there's no telling that even jaw surgery will help you. Jaw surgery is just jaw surgery. It's just cutting the bones and moving them forward. The most important thing
And
for you is alignment.
yeah, well, I hopefully prolotherapy will take care of that. I'm trying to prevent further damage by aligning my jaw. I'm not trying to fix the problem by like expanding my jaws. That's
But
not what
but
I'm trying to do.
but what I'm talking about, alignment in your jaws. That's where the hard part is. The spine, and probably you can correct me if I'm wrong, but the spine is downstream of the jaws. The jaws are what's setting the rest of your body into poor alignment. And so, yeah, you can use prolotherapy, like I was saying before. Prolotherapy may straighten you out from the neck down, but if you don't fix your jaws and get those right, then that the spine is going to keep collapsing over and over again. It's going to be an untreated root cause. And getting your jaws right is no small matter. It's not just about throwing in an appliance and hoping that making it bigger is going to make it more aligned. It's not the way it works. Sometimes the
How
expanders,
come, by the way? It sounds, I mean, at least like, um, how should I put this? Like, if you look at it with like unsophisticated um, point of view, it looks simple. You're short, you need to be linked. There you go. Problem solved. You're saying it's nothing like that. So how
not
come?
it's not like that in a case like yours, because there could be underlying issues that need to be addressed, like TMJ issues. There could be serious degradation of the joints occurring. Um, that's the big one that jumps out at me. Of course, when you're aligning the jaws, the elephant in the room is the TMJ, and expanders are indiscriminate toward TMJ
Really?
issues. The MSE could make the TMJs worse if it's not done right, or if it's or if the joints aren't kept in perspective when the expansion is occurring, right? Like that's the issue, the temporomandibular joints, to put it shortly.
Mm-hmm.
And if
Got
you're seeing doctors and they're not specifically doing an analysis of your joints and what's going on with your joints, then that's dangerous, because that's where they should be looking with someone like you.
it. Mhm. And all right, that makes sense. What did you like about Dr. Yousefi's approach?
I like that when he sees a patient, he gives them a 20-page analysis, and the first few pages concern sleep apnea. He won't even, treat you unless you do a sleep study. And then the next couple of pages are all about the TMJ and all about what needs to be done to the TMJ to get it right. And then only once the sleep apnea and the TMJ issues are discussed and diagnosed, only then will he even consider mentioning an expander or some other orthodontic treatment to give you. It's all done in the context of sleep apnea and TMD.
I hear you.
rather
And
than
what?
just rather than just, oh, Ohad, your jaws are small, let's make them bigger.
Right.
See how one approach is getting right to the heart of it, which is we have these issues, TMJ, sleep apnea, whereas the other one is too simplistic. It's just, let's make it bigger. For some people, make it bigger is fine, but not for someone whose neurological issues are so bad that they're, you know falling on their girlfriend in the middle of the night and going to the emergency room because of issues in their spine. That's a different thing.
Hopefully that could be resolved. But you're saying that if I'll not like correct the root cause, then it's just a matter of time till the whole structure falls apart again.
That seems to be the way it is with the body and with anything in life. If you don't deal with the root cause, then the root cause continues to cause problems.
Right, right. And in terms of Dr. Yousefi's perspective about TMJ, is he like mostly pro surgery or you're not sure?
Like double jaw surgery.
There is this like jaw joint surgery. I'm
Like
not sure what they're replacing the joint. I'm not sure
joint
what.
replacement. Yeah,
Yeah.
I don't know. I would suspect that he would only want to do that if the joint was unsalvageable. But from what I've seen, his approach is to use every orthodontic tool available to get the jaw to revive the jaw, to get it healthy again, and maybe let it live.
Is that even a thing?
You
How is
just
that
bring it back into alignment, and then the degradation stops.
using a splint or something that keeps it in place?
Initially a splint, but then ultimately orthodontics to get a permanent uh, placement of the jaws in the same position that the splint has them in.
How is that done? Are they just adding porcelain on my teeth to keep it to change the bite? How is
No,
that?
it's done by changing the bite without adding porcelain to it. I mean, that's his job, right? Is to understand the details of the orthodontics itself. But part of what's happening is he's just making it bigger, right? And then part of what happening is that he's intruding some teeth and extruding others to get a kind of a rotational effect in the bite from a from a dental using dental change rather than through counterclockwise rotation that they would do in a surgery. So he's mimic. I think, and I, if I'm wrong about this, then maybe his son Ryan will comment. But part of how you change a bite mimicking surgery without doing surgery is by intruding some teeth and extruding others to change the angle of the bite. It's not easy, and it's
It's
very
like intuitively, it sounds like a workaround. You know what I mean? Is
well.
that
It's if you want to call it that, but what's the alternative? Go get double jaw surgery?
right? Right.
It could be a workaround, sure, but at the end of the day, you're avoiding the trauma of surgery, which for a lot of people, that's a requirement, and it's probably a good thing to avoid having your face hacked off if possible. And then also remember, in most cases with Dr. Yousefian, or in where appropriate, there's also this magnificent transverse expansion that's occurring. The MSE and the dame, or the main and the dame, getting this profound nasomaxillary expansion and this profound mandibular widening, which is surgical. I mean, to say that that's not surgical is a little bit ridiculous because, I mean, the surgeon is doing it. The surgeon is making the cuts. So it's literally surgery, but it's also a transformation of the underlying skeletal bone.
How I'm sorry, English is not my first language, obviously, so it's a bit difficult for me to find the right words, but like how invasive is surgery? Is the surgery, are you under like anesthesia? Is it like you're locally numbed? How is it done?
So I suspect that when main and dame are done, when the maxilla and the mandible are both widened, when he's putting distractors in the upper and the lower to to split the bone and widen it. The expander's not actually splitting the bone. The surgeon is splitting the bone. So you probably go into the surgeon's office. I doubt that it's a hospital. It's probably just an office procedure. They either sedate you or put you completely to sleep, and then they do one cut here, right on the chin,
Mhm.
or on one side or the other, depending on how asymmetric your mandible is. And then there's another cut at the top. That could be the full-on dome procedure, or it could be a dome light, which is just the chisel down the middle. So it's nothing like Lafort double jaw surgery where they're cutting the maxilla, making it like a denture that's completely cut off from the rest of the face, and then moving it and plating it forward. It's not like that. It's just cutting essentially the midline of the mandible, putting a distractor in, and then cutting the midline of the maxilla, and then putting a distractor in.
Gotcha. Um, are the results comparable? Like
To double
to
jaw surgery,
yeah.
they can be. Yeah. In terms of treating sleep apnea, they can be. And in terms of treating temporomandibular disorder, sure, they can be.
And in terms of the actual expansion you're getting.
Well, the expansion in some ways is more than you're getting with double jaw surgery, because a lot of times with double jaw surgery, it's just about advancement. It's not about widening.
Hmm. Interesting. So in that sense, it's even better.
In a sense, it's even better. In the lateral dimension, it's better.
Interesting. All right.
And the question, is it comparable to surgery? Again, with regards to what metric? With regards to treating sleep apnea, yes, it can be. With regards to treating temporomandibular disorder, yes, I would not want to count on a surgeon to treat my TMJ. I would much rather have an orthodontist who can be careful and deliberate and more subtle treat my TMJ issues. I wouldn't want to go into surgery with, you know, a really bad bite and then count on a surgeon to fix it. I wouldn't. I would rather have the orthodontist do that.
Interesting. All right. And in terms of like forward growth, I've seen this mask and maybe some other appliances. Would you recommend a mask, this facial mask for forward growth?
It's hard for me to recommend a face mask for anyone who's not a class 3, which means their lower teeth are in front of their upper teeth when they bite normally.
Yeah,
You're
that's
not a
not.
class 3. Right. Yeah, your bite is good. So it's very narrow though. You would definitely benefit from Dr. Yousefian's transverse expanders. Smile again for me, please, Ohad.
Wait, let me just get closer to the camera.
And can I see the roof of your mouth? Yeah, bro, you're narrow. You're very narrow, man. You I would definitely consider some transverse expansion prior to any MMA surgery that you would consider doing. You're really narrow. So even if you do the surgery, what you call the surgery, the MMA, you might consider some transverse expanders before the surgery just so that you get 3 dimensions of expansion.
Which type of, I mean, would you mind showing me one? I mean, never. Which expanders are you referring to?
I'm referring to Dr. Yousefian's main and dame expanders. The only way I could show them would be, I mean, have you seen my interview with Dr. Yousefian?
I've seen like 10 minutes and then I had something came up and I had to leave.
Yeah. The best way for you to familiarize yourself with what I'm talking about is by watching my interview with Dr. Yousefian. Let me see if I can pull up a relevant clip.
By the way, how much is it? Like the treatment, roughly speaking.
I think all of the treatment with Dr. Yousefian is going to be close to 20,000.
Gotcha. Well, if I can prove that it causes sleep apnea, I might be able to get my insurance to pay for it. Thing is, I'll have to get a recommendation from an Israeli doctor to do this procedure for like sleep apnea reasons. And that could be challenging. I went to this sleep study at one point and I couldn't sleep without my splint. I just couldn't. So after a few hours, I just put the splint back in my mouth. And when I came back to see the results, they said, "You're fine. You have 0 sleep apnea. You're good. Go home. Everything is okay."
Mm-hmm.
So
Yeah, that's crazy. Let me try screen sharing with you. Can you see this?
it's loading. Yeah, I can see.
So
Wow.
that's the upper expander. You see this massive diastema. This expander also pushes the front teeth forward a bit. It gets you some forward expansion. I don't think this guy did a lower jaw expander. But then you can see how much change there was
Yeah,
there.
looks way different. Way different.
And then in terms of the lower jaw expander, let me see if I got anything on that. Now it's different, right?
Yeah. Yeah, I can see the gap. It's huge.
That's the lower expander, see it?
Yeah.
So there's an
Interesting.
expander on the upper.
Do we have a before and after picture of this guy?
I'm sure we do. Give me a second.
By the way, what's Dr. Mew's opinion on like mewing for adults? I mean, how beneficial do you think mewing is for adults?
Mewing for adults is good for soft tissue development. It's not good for bone change. In a nutshell. And I'm sure Dr. Mew would say the same thing. Mewing for adults, if you want bone change, you have to look at it, in my opinion, in a 5 to 10 year perspective. But someone like you is not just going to mew and make their jaws bigger overnight. It would be maybe a 5 to 10 year process for you to get any significant change in the bone. And even that might not be as significant as you like. So, yeah, basically, mewing for adults is very limited in terms of what it can do for the bone, but it's still worth doing for strengthening soft tissue, increasing tongue strength, um, developing nasal breathing habits, treating sleep apnea by learning to keep your tongue pressed up on the roof of your mouth at all times. It has a lot
How
of
do you
good.
do that while you're asleep? I'm puzzled by keeping your tongue at the roof of your mouth when you're asleep.
Well, for someone like you, it's probably impossible because you're so narrow. There's no way that you're going to be able to do it.
I
Just
have to
look.
actively push my tongue, and even that feels like it doesn't feel comfortable in any way.
Right. Yeah, I'm not surprised to hear that. Yeah, someone like you, if you want to habituate good mewing, you're going to need an expander to get you started. Even I did, and I was much wider than you when I started. I mew much better after the MSE just because mewing is easier when you have more space. It's more natural.
Makes sense. Makes a lot of sense. I'm just kind of worried about the anesthesia. I hope he could just sedate me because my body is I'm now reacting to things. I have food sensitivities. I'm not sure why, but things got out of whack. My entire body got out of whack. And so that's why I'm trying to avoid, you know, very invasive surgeries, like new drugs. Um, yeah, I wonder if that's something that can be done, under like light sedation instead of full blown. Um,
It probably can. It probably can. So you're more afraid of the anesthesia than you are of the procedure itself?
yeah, absolutely.
Yeah, I think anesthesiologists are usually very open to negotiating the level of sedation. I know the last surgery I did where I had a thing removed from my body, a little growth. I told the anesthesiologist that I didn't want to be oversedated because I didn't want an anesthesia hangover, and they only very lightly sedated me, and they used a ton of local. So, and that worked out fine.
Interesting. Wow.
You can always ask.
So does he do online consultations? Is that something that he's open to?
I don't know. I don't know. You'd have to call his office and find out. Probably, but
Got
he's gonna want you to take scans, and he's gonna want you to do a sleep study.
a sleep study is very complicated for me because I also have a deviated septum. So if I'm just trying to sleep regularly without a splint or without putting like nasal spray, there's zero air I can use. So this sleep study is it's challenging for me.
Well, if you'll just fail the sleep study. You'll show sleep apnea, and then he'll know what he's working with. That's the point.
I I I I can't even fall asleep. I tried it. After like the fourth hour, I gave up. I
Yeah,
can't sleep. So
yeah,
yeah, well, I
yeah,
mean, but it is what it is, right?
yeah. Just tell him that. Maybe he'll get the point.
Right. All right. So in terms of forward like expansion, you're saying like most of the device push on teeth anyway. So the only real way of doing forward growth would be by surgery, right?
The
Ain't
only way
nothing.
to get significant amounts of forward expansion is through surgery. Yeah, more than a few millimeters.
I hear you.
It's very
Well,
unfortunate, but that's just the way it is.
so what about all these people raving about, the upper appliances and stuff?
What upper appliances?
I don't know, how do you call them? The ALF pushes forward, or I'm
Well,
not sure.
the that's a tooth-borne expander.
Hmm.
That's just pushing
That's.
teeth.
I think that some of them claim otherwise, though. I think I hold the same viewpoint as you, but I think a lot of them say that,
Everyone offering tooth-borne expanders claims that it's expanding bone. The reality is it's expanding bone to a negligible degree, and it's mostly just pushing teeth through the alveolar bone outward, or even just tipping the teeth. That's the reality. What people say in this business means almost nothing. Means almost nothing. Even the doctors say the wrong things when it comes to the tooth-borne expanders. There's a lot of delusion around tooth-borne expanders, specifically AGA, DNA, ALF, homeoblock, anything that's just pushing on teeth. Everyone says, everyone who provides them says it's a bone-borne expander. It never is. Maybe if I'm being generous, 20% bone expansion, 80% tooth. And that's being generous. It might even be closer to 90-10.
Wow,
Yeah.
that's amazing.
That's the sad truth.
Well, at least I know, right?
Yeah.
At least I know what to avoid.
Definitely avoid that, bro. Definitely avoid that.
Gotcha. All right, man. It was great talking to you. I have a lot to digest. Not sure how to tackle this. I'll definitely speak to Dr. Yousefi. Um,
Yeah. Take
just
your
as a,
time. Take your time. Keep doing your prolotherapy. Keep getting better. Get more information from Dr. Yousefian. Again, take your time and just take it slow. Don't rush into anything here.
yeah, that's some good advice, man. Thank you. One last question. Uh, is Dr. Yousefi's approach like very um uh like visibly noticeable? Do you see like a significant visual change in your jaw using
Oh
his
yeah.
approach?
Yeah, usually I mean if you do expanders, then the answer is yes.
Yeah, it looks good.
I mean, if for a narrow face to get wider, it usually looks good, especially if you can expand the upper and lower together. When you expand only the upper, sometimes it doesn't look good. It looks asymmetric. It looks like a balloon face because
Yeah, I
it's just
wouldn't want that.
no, you won't. You won't, and that's why I like Yousefian so much. Is when you do the upper and lower together, you get symmetry. You get a full facial widening instead of just mid facial widening, and then the chin stays narrow. So yeah, it looks better.
Sounds like an egg-shaped head.
It is egg shaped. I refer to it as balloon shaped. Um, but yeah, like an upside down egg, maybe.
Yeah,
Yeah.
right. And does it affect your cheekbones?
Yes, it does. It does affect your cheekbones. Unless you do the dome, then it affects them less. But yeah, if you get a ton of nasomaxillary expansion through something like the MSE, it has an effect on the cheekbones because
Could
they're
it even
connected.
change the angle of your eyes? Not
Mm,
not not that
that's
far.
pushing it.
I'm pushing it.
That's pushing it. The effect that nasomaxillary expanders have on interpupillary distance in the eyes is subject to debate. Some people say it does, some people say it doesn't. If it does, it's minor.
Interesting. One last question. How many times a day do you ask yourself, how would I have looked if I knew all of that as a kid? You know what I mean? Because I think like getting into this more and more, I'm starting to think that beauty is acquired, so to speak. And if you raise your kids right, you're like bound to raise supermodels in a sense. Does that make
It's
sense?
it helps, but it's not that simple.
Really?
There's a huge genetic component to it. It's not all genetic, but yeah, for you to have really developed properly, your parents would have had to be extremely healthy before they gave birth to you. Okay. You would have had to have had a natural childbirth. You would have had to have been investigated for tongue tie as an infant. You would have had to have been breastfed. Then, after significant amounts of time breastfeeding, you would have had to self wean directly onto tough, chewy foods, no puree, no mush. And then, even at that point, you could still have issues with your development, and you would need, in addition to continuing perfect habits, you would need the right orthodontic intervention at an early enough age to make sure
Even
that
after
you're.
doing everything right?
Say that again.
Even after doing everything right, chewing on hard food,
Yeah,
breastfeeding, standing straight, no mouth breathing, even after all of that, you might need extra help.
yeah, yeah, definitely. This is something I discussed with Dr. Courtney Donko on my interview with her last week.
That's amazing.
Yeah, it's amazing in a way. It is it takes the pain away a little bit because you're like, well, fuck. Even if I was perfect, I still might have gone sideways. Uh, but in a way, it's terrifying because you're like, fuck. Even if I give my kids perfect everything, they could still have bad genes that cause their development to be imperfect. It's scary. And on the other hand, you could have someone with really good genetics who they could have a shit lifestyle as a child, and it's the opposite. They still have good development even though they had bad inputs. So that's not to say that inputs don't matter. Of course they do. Of course they do. Um, it's just to say it's complex.
Hmm. Interesting, man. Super interesting.
Yeah. And you know the other thing you have to consider is epigenetics, which is to say
How
if
your
you're
environment affects your genes.
well, I'm specifically thinking epigenetic handoff, which is to say the fact that epigenetics can be inherited, which means that if your parents had bad environment and the cues that their bad environment gave their genes to develop small jaws, then their genome is not
Will
coding
tend
for the.
to have a tendency towards that direction.
Yeah, right, exactly. Because their genome is not coding for the proteins that cause big jaws, those genes are shut off by the environmental cues that they had whenever
And they
in the
can pass it over to you
the
by
epigenetics gets
code or by their behavior.
genetically, it gets the
By
epigenetic
code.
the
Wow.
epigenetic shutdown of the small jaws could be transferred to you so that even if you had good environment, you're still not coding for the big jaw proteins. Yes, it's
That's
clear
even
now
more
that
mind blowing than the previous thing you said, man.
it's sad, man. I know. But yes, it's clear now that epigenetics can be inherited. So then you
Cool.
have this cycle. You have this cycle of small jaws that happens from generation to generation.
Oh well, I understand what you're saying, but look on the flip side, on the bright side. You as a parent, knowing these things could like significantly impact how your child develops. Whereas to our parents, they knew nothing about it, right? They thought soft foods were good. It will prevent you from like choking yourself, and you know
Breastfeeding's bad. Give the kid a bottle. There's no need for you to breastfeed. Go to
exactly,
work. Don't breastfeed.
exactly.
Right. That's how our parents thought.
Yeah, so us knowing all of that, that's I mean that's a huge advantage, right? Let's try to think about things in a positive way. That's a major factor.
100,000%, man. My plan with my future children is to give them every possible chance to succeed. And I'm already thinking about it. Okay. And um, I have this vision for this invention that I want to create, and I think it would help so many people because I feel like the number one thing people are missing is breastfeeding. I know it's not the only thing, but
I
it's a
wasn't pressed, by the way.
neither was I. I want to invent fake breasts that I want to invent a set of fake tits that have the same mechanism that real breasts have, and then the father or the nanny or anyone can
Breastfeed.
breastfeed the baby. That way the wife doesn't have to be home all the time breastfeeding. She can go work, she can take a break, she can do whatever she wants, and you don't count on one woman to for this critical
Yeah.
part of the child's
In 50
development.
years, they'll find out that there is a secret component in mother's milk that is also essential, but we didn't know at the time. You know what I mean?
Oh,
So I
you could
think
look. mothers frequently pump milk and feed babies breast milk through
Right,
bottles.
right,
So
right,
she can pump all she wants when she's feeling ready, and then she can put the pumped milk into the fake tits, and feed the baby that too.
right.
So
Makes sense.
so it's possible that you can have the best of all worlds.
That's man, that's fantastic. I was under the impression that they already have something like this. They don't?
I've searched far and wide. I can't find anything. There was a movie called Meet the Parents with Ben Stiller and Robert De Niro about 15 years ago, where there was a joke about it, about the fake tits to feed the baby, but it was a joke. I had never heard anything about it since, but it turns out we really need that. We do. We need that.
Wow. So the only way at this point is like natural breastfeeding.
It helps, bro. It's one
Right,
of the
right, right.
it's the thing that it's the thing that's very hard to actually do, and that very directly teaches the child to press their tongue up and forward, which we know will guide growth in that direction.
Can I ask you a question about that? So I think it's just a guess of mine that thumb sucking is a way of the body to get some forward growth. Does that make sense to you? Thumb sucking. You know, as a child, they suck their thumb sometime. It could be a
Yes, I
compensation
see what you're
mechanism.
saying. Yeah, all humans, even adult humans, have oral fixations. We love to have things in our mouth. We love to chew on
I'm wondering
pen.
if that's some
We,
sort of like, a mechanism designed to give us some more forward growth.
I mean, it doesn't have that effect.
Does it?
No, it has the effect of creating an open bite. Oh,
Wow.
you haven't seen those open bites that kids get from thumb sucking? Oh, it's
Wow.
horrible, man. The front of their mouth is it looks like the predator. It's just a big hole, and there's teeth surrounding the hole like a halo around the sun. It's terrible, and it's very difficult to correct orthodontically. No, sucking your thumb does not give the same effect as sucking milk out of a nipple, because the thumb obviously is much bigger, and then it keeps the tongue low on the floor of the mouth, and it uh, disrupts the position of the teeth and causes the teeth to flare out on the upper and the lower. It's
That's bad.
nasty.
Okay, dismissed. Uh,
Yeah.
and there are crazy stuff out there. I've just bumped into a video of this guy saying that I think it's called jaw hacking or something, where they
Face
just,
smashing.
yeah, they break their bones deliberately to get growth. I mean, isn't that just too much?
I don't know, man. Look, I don't know. I can't advocate for it because I don't want to get sued, but it's definitely intriguing. To me, the big issue with that is a lot of the growth that we need is on the inside.
Right. So even if I thickens the outer part, how will that benefit me? I will still have the same inner structure.
Well, it has the effect of like implants. It gives a facade of good growth, but it doesn't give you that inner volume that you need to function properly.
So visually, maybe it looks good, but other than that,
I can't even comment on whether or not it works for that, but in theory, if it did work perfectly, it would still have the downfall of being a completely external change that would be cosmetic,
right, right.
which is fine because a lot of people are just trying to look smacks, and that's fine. Um, it's better than having a plastic implant. And fighters bone mash all the time. Actually, I think they call it bone smash. It's not bone mashing; it's bone smashing. I think what you're talking about. But yeah, like think about a Muay Thai fighter, and how they kick wooden planks to strengthen their shins, right? It's safe, right? As long as you don't fucking break yourself in the process. You have to find the limit of how hard you can push it so that you're damaging it but not breaking it, and so that you recover a little bit stronger. People do this all the time. Think of like in Kill Bill where she learns the 1 inch punch and she's
I,
punching
I,
that
I
plank.
get, I get, I get the notion behind it. It doesn't sound right to me. I mean, yes, if you're a fighter and you need to have a very dense bone, thick bone to protect you, right? By all means, go hit yourself all day. But for an average Joe to hit himself for some thickness of the bone, I don't know, man. For me, intuitively, it doesn't make a lot of sense.
I know, Ohad. I know. And look, me and you were a little bit older. You got to feel for these guys, though. I mean, these guys, they live in a whole different world than me and you. These guys have never had a girlfriend. They're trying to look better on their Instagram profiles, and they have stresses that me and you never had. I mean, when we were kids, did you ever worry about how you looked? I never did.
I always had like gorgeously looking girlfriends, man. Never had a problem on that front.
And that's because, and it's because you're a fucking cool guy.
Thank you, sir. Thank you.
So, I mean, it's definitely not because of your facial aesthetics.
I guess it's not. I guess
I'm
it's
messing
not,
with you.
man.
No, man. No, you're a stud, man. You're a stud.
No, no, but in any case, I hear what you're saying, especially these days when um, they try to look like an Instagram filter, so to speak, and that creates a very unachievable bar they need to.
It's tough, man. It's tough being a young guy these days where you're judged not on who you are on the playground or in the lunchroom or out at the movies on the weekend in the city. You're judged based on what you look like in your profile picture or on a selfie video on TikTok. It's tough. So these guys are looking for anything they can do to inexpensively look smack.
Can I say something about
Yeah,
that, man? As
yeah,
as an elderly, reaching
please.
my 40s, if you want to attract the opposite sex visually, it's no doubt about it. It's important. But as a man, I'm not saying that your appearance doesn't count. It does count for sure. It does count. But if you go out and pursue your dream and you're actively building your life and self-esteem, that, from my experience, is a ton more valuable in terms of who you're attracting than just looking good. If you're insecure but you look good, your looks is it's almost worthless in my opinion. Girls could read your mental state. They could see how confident you are. They could see if you'll be a good provider. They could sense if you're tough, if you're strong, because like biologically, they need someone to protect their offsprings. And if you're all pretty, but you're full of shit, you're weak, and you don't make enough, not make enough money, you're not taking care of yourself, that's the real secret, man. All right, you have a wider jaw, great. So she might think that you have more testosterone and maybe you're more confident. But in real life, if you can't cover that look with real confidence, you're nothing. You know what I mean? So if I were to give advice, I would say work on your inner self. Be confident. Grow yourself. Go pursue your dream. And to me, if they're putting that Instagram illusion and say, I will only be able to achieve girls if I look like this, or I'll be confident once I look like that. It's a never-ending game. It's a never-ending game. You need to work on yourself from within out. Does it make sense? It's hard for me because my vocabulary is not that big. So does it make sense?
It makes perfect sense, and I agree 100,000% with you. And I frequently put that message out on my channel. You're 100% correct. One of my favorite stories I like to tell is I had a friend in high school. He was a star football player. Okay, he had the biggest, squarest jaw you'll ever see, and he was a stud on the football field. Probably one of the best in the state. But then when he would talk to a girl, like as soon as the girl would come in, he'd be like, "Oh, hey." Like he would change. He would change. And
there you have it.
And
there you have it.
His voice was insecure, and it's like completely not in sync with his body. And so I think if you had to have one, like, or the other. It's hard to say, do you want the looks or do you want the spirit? But you definitely need both in the end. And if you had only one of them, you'd probably be okay. So if you don't have the looks, you can develop the spirit and you can still attract women. The other message I've been trying to send is people have they feel like they have to do more than they actually have to. You don't need to be Dan Bilzerian. You don't need to attract lots of women on a macro scale on social media in the form of likes and comments and subscribers. You need to attract a woman, one woman, and there's 3.5 billion of them out there. And so looks maxing might be good if you want to be like a Dan Bilzerian and if you want to live life as an avatar, right? If you want to live life as a two-dimensional ones and zeros image on someone's screen somewhere. But if you're not a perfect looking guy and you still want to attract a woman, there's a whole wide world of women out there that you can meet in person where they're going to have a better chance of, like you were saying, reading your vibe, reading your mind.
If
And
you
you only need one. You only
listen,
need one.
a lot of times, us as men think that women judge men by the same standard. I'm sorry, that's completely incorrect. We are visual creatures. We see tits, we go wild. We see like a nice looking girl, we're like all messed up. Like we're our entire operation system goes, haywire. A woman does, in my opinion, appreciate looks, but to an extent, not like us men. We are more driven visually than women. And that's, listen, I've dated dozens of girls, over my life. And I've asked some of them. And that's the answer I got. Now, it could be that it's biased because these are the women that were with me. Could be. But from my experience and other people's experience, looks matter, but not as much as it matters a guy. When like our looks is very high or on a man's priority when it comes to a woman. I'm not sure it's to the same degree from their end. I'm
It's
not sure.
absolutely not. It's not to the same degree. You're 100% right. And the fact that some people, this is obvious. Like this is science. This isn't even your opinion. This is a scientific fact. We can look out into the society and we can find countless examples of physically unattractive men who bring something else to the table, who attract lots of women. Uh, and so, yeah, any black pill guy who thinks it's over should really come to terms with the fact that while, like you said, looks do matter, looks are absolutely not everything when it comes to women being attracted to men. The happy middle ground is to maximize your looks as best as you can. Okay. Go ahead and looks max, please, and use my channel to help you do it. Okay. But at the same time, you better fucking develop every other part of yourself at the same time so that you can augment your attractiveness in multiple dimensions, not just in the physical. And, at the same time, you're going to become a better, happier person because becoming a good, happy, high functioning person is what's attractive.
Exactly.
It's a holistic
Exactly.
process.
Exactly. And your looks will go away at some point, by the way. But and your character will last. Your looks will go away. And you'll not be a stud in your 70s or 60s. But your state of mind and what you accomplished, that will last. You know what I mean? And
Yeah.
that's
Yeah.
I'm
Yeah.
not saying, again, don't get me wrong, looks, I mean, it is super important. Not important, it's super extra important. Just saying, put things in perspective and follow your own goals. Just that's what I'm trying to say.
It's never over, bro. That's my message. It's never over. There's always something men can do to improve themselves, be happier, be more attractive, and live better lives. There's always something you can do.
I agree. I 100% agree, man. All right, man. It was very insightful talking to you. You're Fascinating, man, Ronald. Thank you for all the information you've given me. I have a lot to digest. Um, I'll definitely speak to Dr. Yousefian, see what he suggests, um, and I'll take it from there.
Good, good. I think you're going to be in good hands. And if there's anything more I can do to help you, let me know, and keep me in the loop. It was great talking with you. Thank you for sharing wisdom with the audience. I've learned a lot from you this call about uh, spinal misalignment and the downstream effects of nerve compression, about Starecta, about prolotherapy, and I really enjoyed the advice you gave to the young men about, um, how you've had a prolific dating life, even without uh, the biggest, widest maxilla and the most forward projected jaws, and how you've done that by building yourself up as a man, being a better person, having financial and career success, developing your personality. That's I couldn't agree more. And I really appreciate your insights.
Thank you, sir. It was a pleasure talking to you.
Okay, Ohad, take care. Bye bye.